Hey, Dr. Rhett Polka from the 180 System. Today I want to talk to you a little bit about Olympic lifting. So there's a couple of strength coaches that I follow on YouTube and Facebook, one of those being Overtime Athletes. I think they do a great job of breaking down movement patterns and really focusing on correct mechanics and correct programming. One of their videos was about how they don't like to program Olympic lifting for their athletes because they don't have the time to coach them up and make sure that they've got perfect technique when they're doing that, which I support 100%. This came up in the clinic the other day with a patient of mine who came in. I've been seeing him for a couple of years. Once, maybe twice a year, he'll throw his back out, get a bad pelvic shift, and come in. We see him once or twice, and he's back on the road. So when we started seeing this patient, he was largely sedentary, desk job, has to drive about an hour to get to work, both to and from work every day, and really wasn't doing a lot of exercise a couple of years ago. Now he's running 12 to 15 miles a week. He's playing pickup basketball 2 to 3 nights at the gym, and on the nights that he's not playing basketball, he's lifting. So he came in the other day, his back was irritated, and I had him show me what he's doing in the gym. And he said that he was doing some Olympic lifting, and I said, well, what do you mean? And he said, well, I'm doing cleans. So I said, okay, how's that going? And he said, well, I'm not quite sure if I should be doing those. And I said, okay, so are you doing those for a purpose, or are you doing those because you saw somebody else do them and thought this would be a good thing for me to do? And he said, well, pretty much because I saw other people doing them and heard that they're good for you. And I said, well, they're great. It's a great lift if you actually know what you're doing and you have a purpose to be doing that lift. So I said, well, what's your technique like? When you go down and when you catch, are you in a full squat? Or are you like 90 degrees parallel squat? What's it look like? And he said, well, I don't go down. I only go about halfway down. And I said, well, that's a problem because you're not doing that lift correctly, and the way you're doing it is going to overstress your lumbar extensors and create compressive forces, irritation, and that's probably why you're irritating your back. So with him, we got rid of that because he doesn't have somebody to sit there and coach him up and make sure he's doing it correctly. And we substituted it out with some other things that he could work on, like goblet squats, that are easier for me to kind of show him how to do here, make sure he models it correctly for me. I've already put everything back together on the table so I know that he's sound neuromuscularly and proprioceptively so he can do those things. So that's just an example of how Olympic lifting and some other types of lifting have become more popular in the last couple of years. And so we have a lot of patients that are doing those lifts that probably shouldn't be doing those, not because they're a bad lift, just because they don't have the coaching and the technique to do them correctly. So please think about what you're programming for your patients when they leave the clinic and if they actually know how to do that correctly. So you could give somebody the best exercise, most functional exercise there is. If they can't do it correctly, it's probably not something that you should be giving them. Thanks again for your time. I hope to see you soon. To find out more about what the 180 system is, why it's different, and why it works, follow us, visit us, and as always, welcome to the revolution.